This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is Medtalk, your weekly on-air health consultation here on the Solar News Channel.
One of the greatest known composers of all time, Ludwig van Beethoven, was deaf. He composed his greatest pieces with his hearing almost gone. Hearing loss is not just one of the conditions that an ear, nose, and throat specialist or ENT handles. One also goes to an ENT for consultation and treatment for other disorders or sickness, just as allergies, tonsils, or balance-related problems. One such balance-related problem that falls under the expertise of an ENT is vertigo. Vertigo is recognizable by its symptoms: nausea or vomiting, sweating, and/or abnormal eye movements. These symptoms can last for minutes to hours, and they can be episodic or constant. At 26, Don D is a technical support agent at one of the outsourcing firms here in the metro. He resorts symptoms that could be a sign of vertigo, but this has yet to be confirmed by medical experts.
I usually experience dizziness and often accompanied with hair loss. It happens randomly. Hindi ko rin masyado alam kung bakit, but I think it's what they call vertigo.
Tonight, we will talk about the common ENT-related disorders. With us are our doctors Ricardo Fernandez, chairperson of the Otorhinolaryngology Department of the Makati Medical Center, and Dr. Rodante Roldan, ENT doctor from the Medical City and the Rizal Medical Center. Doctors, welcome to the show.
Good evening, Angel.
Good evening, Angel.
You can join our discussion by calling our hotline, tweeting us, and by emailing us. So doctors, again, welcome to the show. We're going to talk about ENT or ear, nose, throat related concerns. So what is the scope of the ENT practice? Dr. Fernandez?
Well, as you can see, it's ear, nose, and throat. But these days, we dabble also in head and neck surgery. So that includes thyroid surgery, tumors of the sinuses, even up to the base of the brain operations.
Mm-hmm. Why is this included already?
Because we no longer deal with the eyes. It used to be eye, ear, nose, throat.
Yes. Okay. Would you like to add to that?
So the field of ENT is very wide. We often have overlap with other specialties like pediatrics and internal medicine, but we're both medical and surgical, so we can treat the common diseases. And if the medications don't work anymore, we can do the surgery also.
What are the most common complaints of those who have disorders of the ears, the nose, and the throat?
Common colds.
Okay.
And also snoring, sore throat, earaches. These are the daily things we see in our practice. However, sometimes, occasionally, we come across patients whose problems are tumors in the head and neck. And my number one policy is to try and relieve stress by explaining to them exactly what their problem is. Once they have an idea that it's not that serious, or if it's serious, what are the different ways we can deal with it, I pray that I'm able to relieve their stress a bit. Because for me, the problem in health is basically stress. Once we relieve stress, then a big amount of burden is relieved from the patient.
Mm-hmm. So the common cold can be stress-related as well and can lead to other
yeah, definitely.
diseases.
So also common in our practice, especially in light of the, like for example, the patient who works at an business processing outsourcing unit. So we have a lot of call center agents. So we have a lot of patients who are always in an air-conditioned environment, shifting work schedules. Their immune systems are low. They're susceptible to common colds. They have frequent hoarseness because of frequent voice use. So it's really a very big field now, and we can help a lot of patients out there.
When does a patient need to go see a doctor? Let's say maybe it's just a common cold that can be treated at home, or the over-the-counter medicines can cure this discomfort. But when does one need to see a doctor?
When a problem does not resolve by itself, and they feel worse today than they did yesterday, and tomorrow they feel they're worse than today, then they should see their doctor already. However, if they feel that they're better today than yesterday, and tomorrow they feel a little bit more relieved, then I think the immune system is there to help them, and they're on their way to recovery already.
Yeah, so I agree with Dr. Fernandez. As long as maybe you were sick for 3 to 5 days and then you start getting better, maybe you don't need to consult a specialist. But for me, my cutoff is 2 weeks. 2 weeks, you still have the cold or you're still hoarse. After 2 weeks, you should seek a specialist, a particular ear, nose, throat, head and neck surgeon.
Yeah. Here, yes,
Yeah,
doctor. Yes.
However, the #1 problem, again, is stress.
Correct.
Even if they're getting better, they're still stressed. So it's still useful to see your doctor so that your doctor can explain, don't worry, it's not that big a deal.
And can maybe eliminate that stress factor that
Exactly.
leads to like a
stress
throat
can give
infection
can give you rashes, hives, ulcers, heart attack, stroke, death. So
address it while it's still
Address
in
it
that
while-
early
yeah,
stage.
yeah.
And while we're on the topic of addressing, we will address a tweet. We have a tweet from Chris Virtusio. I recently went for a checkup because my tonsils have been hurting, and the doctor advised me to have them removed already. Any thoughts on this?
Well,
Dr. Fernandez?
if you ask me, when you're an adult, a tonsil is tonsils are not anymore required as an adult. It may help warm the air if you live in colder countries like in the North or South Pole, but in a tropical country, it may just be a site for infection when you're an adult already.
So just to further elaborate, so when you're a child, usually your immune system matures from 6 to 11 years old. That's when your tonsils play a big role in developing your maturity. But when you're an adult already, your immune system is more or less mature, so they don't serve as much good. No? But in Mr. Virtusio's case, you have to be very careful about recommending a tonsillectomy outright. So it also depends on the kind of microbiologic agent, either viral or bacterial. How many times a year the patient has sore throat? Does it impact his activities, his work, his lifestyle, or other complications like abscess or like sleep apnea or obstruction, like difficulty swallowing or his voice already changed. So these are options that you may need to do surgery, but not always.
Not immediate surgery.
Well, I would like to add to that. If you get tonsillitis more than a few times a year, you're at risk of developing rheumatic heart and rheumatic kidney disease. So
Better
I
to take
would,
it out.
if you're not sure of what your doctor's saying, go shopping.
Always good to get a second opinion.
Yes.
Yeah, sure, that's your right.
And this is our second tweet. Speaking of second opinions, Francesca Cortez asks, I was recently diagnosed with sleep apnea. We were talking about this, doctors. I want to learn more about this condition so that I can manage it.
So,
Would you like to answer this
sure.
first?
So obstructive sleep apnea is a common condition which is now being diagnosed more because of better awareness. Okay, so when you're sleeping, your body relaxes, so your muscle tone relaxes, the air passages relaxes also, and sometimes other risk factors, short neck, fat neck, it collapses, so the air doesn't go in. And then the brain senses, hey, where's the oxygen in your brain? And you try to wake up, so it's usually snoring, and then no breathing. That's the apneic episode. Your breathing stops. And then your brain senses, okay, our oxygen is too low. You wake up a little. And then you snore a very, very big snore just to get some air and to get some tone. So obstructive sleep apnea may occur in multi-levels from the nose, soft palate, the tongue, the neck. And for children, it's easier to treat with surgery. For adults, you probably need a CPAP, a machine that pushes air forcefully into your lungs. Surgery will be of benefit, but it's really still mainly the continuous positive airway pressure to help push the air into your lungs.
Okay. Doctors, we also have a question from our Facebook page. What is the treatment? This was on the video earlier. Treatment for vertigo. I've had this episode of vertigo.
Well, I would say there's two kinds of vertigo. Maybe there's more, but the two most common types of vertigo I see is the benign positional paroxysmal vertigo, which can be caused by crystallization of fluid in your inner ear. It's like kidney stones, but inside the inner ear. So when you make sudden head movements, they shake or they rattle.
What causes the crystallization inside the ear?
Dehydration.
Okay.
Chronic dehydration. Also, it's genetically predisposed. But there's a way of repositioning those things so you can achieve a cure without having to undergo all these expensive diagnostic treatments. After that, if it's still there, then maybe it's time to do a CT scan to see if there's any congenital absence of bone in a certain area. But the thing is, it's important to differentiate this from another kind of vertigo, which is caused by hypertension inside that structure. That is usually accompanied by hearing loss and tinnitus, or ringing in the ears. It's a very complicated subject, but there's a way of going about it, and as long as your doctor knows what he's doing, you shouldn't worry too much about vertigo. It's not that you shouldn't be stressed with that.
Okay, so, well, I've had episodes of vertigo. We can talk about that a little later on, and more from our tweets and more from our Facebook friends. More on ENT-related conditions when Medtalk returns. We're back on Medtalk and still talking about ENT-related conditions or disorders. Doctor, before the gap, we were talking about vertigo. And since this is an on-air consultation, I have had episodes of vertigo. When I wake up, it's like the ceiling is turning, and I tend to close my eyes because I don't want to see it going around or moving in that manner. So what could be the cause of this?
You can just do it slowly. Get up very slowly.
I'm afraid I might fall.
What you need is particle repositioning.
Okay.
If your problem is due to sudden head movements, then particle repositioning has a high chance of helping you. The other thing you can do is drink lots of distilled water to help your body absorb the crystals. For the other one, the Meniere's disease, the one where there's high blood pressure or hypertension inside, not blood, it's the lymphatics inside. No? There's a lot of pressure there, and it's causing damage to the sensory cells. That makes your hearing less, and you hear tinnitus. Those things might require diuretics to help relieve the pressure.
Okay. When is it a cause for alarm? When how many episodes should one experience before actually seeing an
I think if you're really very bothered, even one episode warrants you to consult a specialist, because one, we have to exclude that the organic disease, like there's really something wrong with you that we need to address either by medication, by exercises, or maybe by surgery. Because also the anxiety component of it also exacerbates the vertigo, or you're afraid to move anymore, like what you said.
Exactly.
Because you feel how debilitating it is. So it further prevents you from, because one of the treatments, possible treatments, is vestibular therapy. It's like a physical therapy, occupational therapy. You actually do the exercises that promote your dizziness so that your brain habituates to it. You get used to the positions causing you to have vertigo so that you're not afraid anymore to move.
There's also medicine, which is a sedative to that part of the body. Labyrinthine sedatives. The only problem is you may not be able to drive, or but it will lower your sensitivity to the vertigo so that it's not that debilitating.
This one is upon waking up. Sometimes when people exercise and they suddenly stop, then they get dizzy, and then they attribute it to vertigo. Is this the same?
It could be related.
May or may not be. So
yeah, because there's also central vertigo caused by central problems, head injuries, stuff like that.
The one you're mentioning might be related to motion sickness or seasickness or mal de débarque. So, like on a ship, and then when you get down to dry land, like you're still moving.
Yes.
So it might be the same. Jogging, and then you stop, and then you sit. Like when you go on a treadmill, and then when you finish, okay, I'm still a bit
still
moving.
woozy.
Yeah.
Yes. But doctors, we have someone on the line.
Sure.
Oh, okay. Maybe we can go back to our
vertigo
in a while. But let's learn more about our ENT-related disorders by responding to an inquiry we have from Rosalie Fuentes. She's 27 years old, but she has noticed that her hearing is not as good as it used to be. Help, please. It's really an SOS. At 27.
Correct. That's very early unless they have a strong family history of hearing loss. Usually, you expect some normal deterioration of hearing when you reach 60 and above. But at 27, she should have her ears checked.
Yeah, it could just be impacted cerumen.
Correct.
Earwax buildup.
Okay, and how does earwax build? Sometimes I've heard this a lot, that when you clean your ears, the more you clean it, the more the wax goes inside.
Yeah, because you end up pushing it inside. It's like packing a cannon.
Yeah, so we have to remember that the wax is an important part of our ear. It catches the dirt, and God in His wisdom already put janitors to sweep the wax out. So it moves from inside to outside. And every time you push it against it, you push it in. So you just wait for it to come out and wipe the towel you use to wipe your face, just use it to wipe the outside of your ear. That's it.
She should see an ENT doctor, so she would know what's wrong. Because if it's not that, it could be a perforated eardrum, which we can do something about also.
Okay. Thank you, doctors. Now we have a caller on the line. Charito Tesoro. Hi, Charito. Good evening.
Hi. Good evening.
Yes, you have a question for our doctors. Please go ahead.
Yes. Well, you know, I have this hoarse voice. I noticed it about already a year ago. By the way, I will be 74 this coming month, and but then this problem was of mine. I have not experienced this before, and maybe you would notice that the hoarseness is evident on the phone. Now, before I can sing a little, but not as sintonado as I am now. And then I also have another problem in the ear. I had a stroke some years ago. I woke up and I cannot hear anymore on my right ear. So I had myself a hearing aid, but it hardly helped. So I hope these excellent doctors could be able to help me. So I hope this.
Thank you, ma'am. Doctors?
Yeah, so thank you for your question, Ms. Charito Tesoro. There's such a thing as age-related degeneration of your larynx or your voice box. So that's called presbylaryngeus. But you should have it checked by an So you are the perfect patient for an ENT because you can visit one doctor and have both your ears and your throat checked. So for the larynx, there's some age-related degeneration of your vocal cords, but we can do something about it. There are exercises that you can do, but it's very important that we have to do an endoscopy to see your throat. Don't worry about it. It can be done in the clinic. It's not very painful. It's not painful. It's just a little bit uncomfortable for maybe 10 seconds, and then you'll be fine. For the ear, or if you have something to add.
Yeah, I have something to add because these problems in the throat are, majority of them come from postnasal drip, you know, like when you have infected sinus problems and it drips to the throat, it infects the throat, or regurgitation, which is not, our throat is not fit for handling acidic substances. So when we regurgitate, we burn our throat, and then usually at night it's worse than in the morning. If we treat the sinus problem, then usually the throat problems goes away.
Okay. And also for the ear complaint, you should have a hearing test done for sure. It may be related to your stroke before. We don't know if the blood vessel or the part of the brain that corresponds to that ear is still working properly. So you should have at least a hearing test done so that we'll be able to say. So I'm also wondering if the hearing aid is actually helpful, because in the hearing test, we'll see if the nerve is still alive or not. So if the nerve is dead, whatever hearing aid you put there, it won't help you.
And she mentioned that she loves to sing, so medyo paos na siya now.
I see.
Yeah. So I'm sure she'd like to get that back, and she'd like to have her
course.
hearing again.
Yeah, she should not hesitate to go right away, especially if her hoarseness is progressing.
Yes.
Okay. Well, thank you for that call, Ma'am Charito. Another question via the Facebook page from Giancarlo Chua. Why can my elderly mom hear certain sounds and not others? Another hearing-related concern.
This is an interesting question. I'm not sure if does he mean that his mom has better hearing than him, meaning can hear people from the other room, or can his mom hear sounds that are actually maybe inside her ear? So might be ringing sensation, a whistling sound or something. So barring more info, I would say that have a hearing test done. So check the ear first. There's no wax. There's no perforation of the eardrum. Then have a hearing test done.
Dr. Fernandez?
One easy explanation could be noise-induced hearing loss, which can lower her sensitivity to certain frequencies. So she can hear more other frequencies more than
The other.
that particular frequency.
Okay, so again, consult your ENT
have her
doctor.
ears
Consult
checked
us.
first.
Consult the doctors.
Yeah.
All right, we have questions from Twitter. This one is from Jessica Lim. What are the different kinds of hearing loss?
Okay. So there are three main types. Conductive hearing loss, meaning there's a problem of sound conduction, sound from the environment going into your ear. So that's conductive. There's sensory neural hearing loss, which means the nerve from your ear to the brain is not functioning properly, or a mixed type of hearing loss, where there's both a problem in the sound conduction in the pathway and from the nerve of the ear to the brain. So it can be conductive. Example is wax in the ear. Sensory neural hearing loss, an example is age-related or maybe overdosage from certain drugs. And then mixed type can be both. You just have two pathologies in your ear.
Again, when is it cause for alarm maybe, or when should one see
Wait, I can add to
a
that.
laryngologist? Yes, please, Dr.
There's
Fernandez.
also this thing called selective hearing loss.
I was about to ask about. Okay.
That's true.
Okay, that's the fourth. Okay, and that I think that's a more common loss of hearing
Among
concern
teenagers,
among teenagers. Yeah.
Husband and wife.
And that depends on the frequency of the one saying it.
Though in the youth, the problem is they like to use their iPad at maximum volume, and that can cause problems.
Correct. So a good gauge of if your earphones are too loud. So when you're wearing earphones and someone beside you talks to you, if you have to remove your earphone to ask him, huh? That's too loud already. You should be able to respond to them without removing your earphones. That's a rough gauge of, oh, maybe my volume is too loud.
Okay, or again, maybe they just
They just-
choose not to
Yes.
listen to whoever is beside them. Another
Turn
tweet
the volume up.
from Angela Mongubat. What is the best hearing aid I can get my dad?
I'd like to answer that because our ENT Diagnostic Center in Makati Med provides hearing aids.
Okay.
We provide Siemens, and so far all our patients are happy with it.
Okay.
But you know, there are different models. It depends on how high-end your father wants the hearing aid, or just efficient, no? Because we can just concentrate on the speech frequencies. But if he's into music, he wants to appreciate classical music, then the high-end would help him.
Okay. So doctors, what advice can you give our viewers to help prevent hearing loss, or at least minimize the impact if they already have it? Since we're on this topic.
Yeah, so my advice are two things. One, don't poke around in what you cannot see. You can clean, for example, mommies are very good at cleaning their children's ears. As long as you can see what you're doing, you can go beyond what's outside. But of course, if you can't see your own ear, you're just allowed to clean outside here. And two, noise prevention or prevention of progression of noise-induced hearing loss, the gauge of how loud your earphones are, you should still be able to converse with the one beside.
Okay, thank you very much, Dr. Roldan. Dr. Fernandez.
There's only one important concept I want to impart. Our brain is always processing the sound of words. If you cannot hear for a long time and you're not using a hearing aid, your brain will forget to process the sound of words. So it's very important to maintain your hearing as best you can.
Okay. Thank you very much, Doctor. Everyone has heard us, has listened to us loud and clear. Thank you so much to our guests tonight for allowing us to learn more about ENTs and the conditions related to this, and for teaching us how to better care for ourselves in this area. Thank you once again, Dr. Ricardo Fernandez and Dr. Rodante Roldan, for being with us tonight. See you again next Tuesday, 10 p.m. on your on-air scheduled consultation here on the Solar News Channel. This is Angel Jacob. Good night.